So welcome everyone. My name is Dr. Elle Sain. I'm an infectious disease fellow at Penn, and together with Noah Erlitsky, who is a MD PhD student at Penn, we are the co-chairs of the Public Health Outreach Subcommittee of the Community Health and Prevention Impact Area at Doctors for America. And it is our distinct pleasure to welcome you here tonight for our Advocacy Grand Rounds. We have three incredible speakers who are going to share their knowledge on misinformation, disinformation, and science communication in medicine and in the scientific community. But before we start, I just want to go through a couple of housekeeping things. So quickly, I want to invite anyone who is not a member to join Doctors for America. This is an important step in selecting a membership level and paying your annual membership dues, which supports the organizational sustainability and incredible programs like our Advocacy Grand Round series. There are 4 different levels to choose from, and those are detailed on our website. We're also currently offering a fall promo code. Just use the word fall, all capitals, and you can get 20% off your first year membership. And there is now a link in the chat. We are live streaming on Facebook Live and making a recording, and all materials will be available afterwards. And I just want to set a few quick ground rules. First of all, there's no such thing as a stupid question. Please ask any question that you have. Please use the Q&A feature to ask a question, and we'll address all of your questions during the second half of our session. And then our Doctors for America staff will be sharing helpful tips and comments in the chat, so please monitor that for additional information. And now I'd like to introduce our speakers. So we have 3 amazing speakers with us today. Jory Craig is a global expert on elections, public opinion, and online harms. She has over a decade of experience across numerous countries. She's a founder of a constituency advising public figures and policymakers, specializing in strategies to mitigate online harm and navigate the impact of technology on society. She's currently a senior advisor to the Archwell Foundation, a resident senior fellow at the Institute of Strategic Dialogue, and a senior advisor at Onyx Impact. Her work has been cited across many major outlets like the Washington Post and the New York Times. She's testified before Congress on disinformation, and she's been a guest on many popular shows, including the NPR Morning Edition, Pod Save America, a personal favorite of all of ours, and What Now with Trevor Noah. Thank you so much for being here, Jory.
Thanks for having me.
Next, I'd like to welcome Dr. Elizabeth Marnick. Liz earned her PhD in genetics and immunology from Tufts University and completed an NIH postdoctoral fellowship studying stem cells. During the COVID-19 pandemic, she founded Science Whiz Liz to make science accessible, and if you don't follow it on Instagram, I highly recommend that you do. She now leads the development of new science education and outreach initiatives at MDI Biologic Laboratory. And interestingly, Liz was raised in an anti-vaccine and anti-science household, but discovered her passion for science with encouragement and mentorship from wonderful teachers. And she brings this unique perspective to her work, reaching broad audiences. For example, she's a contributing writer for Those Nerdy Girls, another personal favorite of ours, ASBMB Today, and the Global Autoimmune Institute. Welcome, Liz. We're so glad to have you.
Thank you for having me.
And last but not least, I'd like to welcome Dr. Susan Lopez from Chicago. Susie earned her undergraduate degree in Latino Studies at the University of Michigan, Ann Arbor, and completed medical school training at the University of Illinois, Chicago, as well as internal medicine training at Rush University Medical Center, where she's now faculty in the Division of Hospital Medicine. She's worked directly with COVID-19 patients since March 2020, and she's interested in addressing and improving healthcare disparities that affect hospitalized patients. She advocates for students who identify as underrepresented in medicine at all levels of education. And we're so lucky to have you here tonight, Susie. Thank you for being here.
Thanks for having me.
And now with all of that, I'd like to pass it over to Noah, my co-moderator, to kick off some questions.
Hi, everybody. Thanks again for coming. So before we get to the Q&A section, I'm going to ask Jory to do some level setting for us with some slides that she's prepared. So Jory, the mic is yours. You can feel free to share.
Great. Thanks so much. I'm so excited to be here. It's great to talk to this audience anytime. It's so important. So these are just a few slides to get us all on the same page about the way I think about how information is moving in general, including information online, including conspiracies, misinformation, and disinformation that might be reaching people. The first is that we hear tons about medical or health disinformation, health conspiracies, especially since COVID. And there are a couple different angles we hear about. We hear about scams, so people trying to make money off of different influence operations where they're putting conspiracies and disinformation in front of people. We hear about the intersection of medical and health disinformation with political or election-oriented disinformation or activity or news events. And it can be difficult to make sense of exactly what the trends are and exactly what the patterns are. Some of the patterns that are consistent and that have not changed in the past 5 years and remain true are patterns like most people, when they're online, they're not seeking news. They're seeking relief from news. They're not seeking credible information. That, of course, is different when people are entering into their search engines, a specific question about their health or a specific question about their wellness. But in general, when people are passively scrolling, they're not seeking that sort of high quality information. They're sort of there to numb or they're there for entertainment. On that note, when people are scrolling, their attention is limited. They're not in their sort of active mind, they're in their passive mind. And so everything that they're taking in, they might not even realize they're taking in. They might not even realize what they're focusing on. And it's often hard when you're engaging and trying to study people and how they consume information online. It's very challenging to get any type of recall, which gives you some sense that a lot of times people don't really know why and where they found what they're finding online. No longer is there only one source of trusted information, so it doesn't necessarily work to point to trusted sources. So there might be a specific publication or news article that is well known as trusted in a certain circle, but that might not work, or in fact, that might have now been determined to not be trustworthy in another circle. It's not just TV, it's not just print, it's not just social media. It's people's friend groups, it's podcasts, it's streaming, it's rabbit holes on YouTube. And so that also makes it challenging for how you get to the same place and tell people what they can trust and rely on, because everything is so different and people's information diets are so diverse. And while disinformation obviously includes falsehoods, it really does play on real and true emotions. And that will be a theme in the things that I say, which is that a lot of what we encourage people to respond to is the true way that they're feeling. That is usually often easy to empathize with and resonate with, different from the falsehoods that are contained within the information that they are buying into. And then finally, just the fact that right now, the short time horizons that social media really plays into, sort of the impulsiveness and the limited attention that people have when they're online, makes disinformation particularly dangerous, and it makes trusted messengers like you all particularly important, because they're often, especially as AI plays on some of the common tactics that disinformation is already deployed using, we will need trusted messengers who have some sort of credibility or audience to refute a lot of what is going on. And then this is just sort of a summary. What does it mean for us? Often the goal of these things, when it's not financial or when it's not political, the underlying goal is to break down people's trust in institutions, trust in this, entire fields, trust in experts. When people don't trust things, they get insecure. When they're insecure for a long time, they can be emotional and impulsive. And when they're emotional and impulsive for a long time, they feel tired. And a lot of the bad actors that we look at are looking to make people tired, so they disengage, and so they're easy to control and influence. And taking that all together, what can we do as a collective is remember that it is really important that all of us are in this. There are efforts targeting all of us. No one is really immune, no matter what specialty we have. There are really sophisticated actors who can look and seek to blend in with any community and influence any community. And if you have that as a starting point, it can make it easier to address and engage the disinformation and conspiracy when it's presented. So I'm really looking forward to hearing the expertise of the other folks and excited for questions.
Thank you so much, Jory. That actually will go right into the first question that I wanted to ask you, which is, you were talking about the different sources of information that people get and kind of the mindset of people when they're consuming this information. And I'm wondering, what is the motivation for people to start spreading misinformation in the first place, and who benefits from that?
There are a couple different motivations, often financial. I think people all around the world have seen that social media, online spaces are a new way to make money, sometimes just by doing a dance, sometimes by saying something very sensational. And a large portion of what is out there are commercial actors who are interested for financial gain. The next most common area I'd say is a political motivation or something ideological, and often that is intersecting with a financial motivation as well, a grift, a political grift. And a lot of times that doesn't feel like a financial or sort of targeted political push because it's not asking people to directly vote for something, or it's not asking people to directly give money to something, but it is building up an audience and building a relationship with an audience by pushing a certain type of content and then planning to use that audience for whatever the political agenda is or whatever the financial agenda is. There are other types of agenda. Sometimes it's just control over a group, influence with a specific group. Sometimes it is a goal to sort of suppress people or get them or depress people from participating in a certain activity. Also, increasingly, we're seeing hostile rhetoric, which is, which aims to sort of have a chilling effect and get people out of a process because they're, feeling uncomfortable or threatened or being harassed to the point where they no longer want to engage. So those are the most common motivations. There are more niche motivations as well. And, I don't think state actors are exactly the focus of this conversation, but it's worth mentioning that, geopolitical agendas are also out there, especially in this time of year.
That makes a lot of sense. I also would like to invite Liz and Susie, if you have anything to say on that topic, to please feel free to contribute. And if not, then I actually want to turn to Susie to ask about, we were just talking about the politically charged and sometimes emotionally charged kind of situations that people find themselves in. And I think, that we all know that extends very much to the clinic. So as a hospitalist, you're often in high stress situations or with patients who are in high stress situations. And so my question to you is, how do you handle emotionally charged misinformation, particularly with vulnerable populations, without making patients feel alienated?
It's a really good question. I think because you're right, it's such an emotionally charged place to be. If you're in the hospital, you're not feeling well, and all you want to do is feel well so you can get out of the hospital. And you start to hear maybe one thing that someone sent them through WhatsApp or a message or something that someone shared, and they're just hoping for something to make them feel better. But I think at that point, it just takes a little extra time, but really actively listening and listening from a place of curiosity. I think when people come up with this idea, I mean, it takes a lot of courage to ask a doctor, hey, I heard about this thing. What do you think about it? They may not feel comfortable asking it. And so letting them know that it's okay, let me take a listen, you know, let me know where you heard it. What can we talk about with it? And so coming from that place of curiosity just leaves it open, and then asking those open-ended questions so you're able to get more information about maybe where they got that information. I think the other thing too that goes a long way is when I talk to patients, or I also talk to community health workers about dealing with misinformation. Um, so much of what we learn in school is knowing the numbers, and those numbers are important. But when it comes to someone who's in that emotionally charged space, um, the anecdotal stories are going to mean more to that person. You could rattle off 10 million other numbers that mean so much to us, but to them, they want to hear the story about, well, I had a patient who did X, Y, or Z, or there was this, you know, they did this, or they were treated with this. So I think coming from a place of curiosity and understanding where they're coming from and explaining things in a way that they're going to understand and connect with.
So building off of that then, when we frame conversations with patients, taking all that into account, I'm wondering if, Liz, if you can, use your unique vantage point of having come from an anti-vaccine, anti-science household, to help us understand maybe how you ended up becoming now a leader in science communication and a scientist yourself. For example, did you have conversations that kind of stuck with you, or what type of information or ways that the information was framed kind of influenced you toward evidence-based thinking?
Yeah, so I think that growing up, I didn't think twice when my mom told me vaccines were bad. I was like, oh, okay, that's what you said, so of course they're bad. And it wasn't until I started getting into high school, where I was actually in science courses, that I started like thinking like scientifically and asking questions and thinking about what does it mean to make decisions, and what kind of evidence is used for that type of information. And I was lucky that I had really great, it was mentioned in my bio, I had really great teachers who saw that I was really interested in science, saw that I had a talent for it, and then really tried to nurture me into that career path. And if it wasn't for them, I wouldn't have known how to apply for college, because my family was very poor. I wouldn't have had the resources to do that. And it really started off with just like them noticing that I had this interest. And then once I got to college, I still wasn't vaccinated as a college student. I still didn't believe in evolution. I had all these very anti-science things, but I was a science major. I was majoring in biochemistry at the time. And it was during that process of like learning all of these things that I really started to question what was the evidence that those things that I was taught were based on. So I had like a really big like awakening, I would say, of like going back and seeing like what evidence was my mom using to make this decision. And to be totally honest, I didn't understand a lot of her motivation until I had my own children. And when I had my son 5 years ago, I suddenly was inundated with all these messages about how important it is to keep your kids safe. And for me, by that point, I had my PhD in immunology, and I knew for me that meant vaccinating my kids, because I understood the evidence. And I went back and I talked to my mom, who still is, we're working on it. We've built ground, and we've come to some understandings with each other. But when I had my first child, she was like, "You're not going to vaccinate him, right?" I'm like, "Mom." By this point, I had gotten myself vaccinated at 20, and a little bit after I had gone through college. And I sat down with her and I asked her, like, what happened? Like, why did you decide not to vaccinate me? And she told me that she gave birth to me. She went and asked her pediatrician about vaccines. She had some questions, and he told her that you vaccinate your kids because that's what I told you to do. And I mean, this was in the 80s. So, but he wasn't willing to answer her questions. So she was like, okay, I now hear all these things that vaccines are going to hurt my kid. And as a mother, my job is to keep my kid safe. So since you're not going to answer my question, I'm just not going to vaccinate my kid. And that was what she did. And then from there, I think that really drove her into more of finding all of this information that was wrong. And this was even before the internet was as popular as it is now. So I think that really was my experience, and that really motivates the work that I do now, because I think a lot of us, kind of what Susie was mentioning, we all have these very emotional reactions to things. And a lot of times, like a big common factor I find with people I'm talking to is that they're wanting to make decisions, especially when it comes to health, that keeps themselves and their families safe. And if you're inundated with misinformation and disinformation, then it's easy to think that the safest decision is not to vaccinate or not to do X, Y, Z because you're inundated with all this misinformation. And if you don't know how to navigate that, then that can be challenging. So when I'm talking and communicating to individuals, that's where I start. Is I start with understanding that, like everybody, like my primary focus in life is to keep my kids safe. And that's what they want to do too. We're just coming at it from different angles because we have different foundations of knowledge that are helping us make that decision. And then from there, I can start to have those conversations about where did you get this information and what kind of information can I give you that might help assuage your worries and those types of things.
I'm wondering if either drawing on your own experience going through that process of we can call it enlightenment, or through your work now, and maybe also for Susie, based on what you see in clinic, do you think that there are any kind of early warning signs that patients might be vulnerable to misinformation? Maybe this is part of that, taking stock of their preconceived notions part. But I'm curious if that's something that we as physicians can be on the lookout for and maybe somehow intervene before they disengage from evidence-based care.
I know in my experience, I see that a lot of the people who follow my account are moms. Maybe I think it's because as a scientist, I bring also the perspective about parenthood and all of those sorts of things. And I think parents in general can be very like susceptible to misinformation because again, it preys on those fears of wanting to keep your kids and your family safe. And there's some interesting work being done in like what we call like inoculation theory of misinformation or pre-bunking. So it's kind of preparing people ahead of time for the type of misinformation they might get. And I think one of the things that we can do, maybe like OBGYNs can start having these conversations with their pregnant patients ahead of time, because it's once you have a baby, the algorithm knows, and then all of a sudden you're inundated with all of these things, both good and bad, about parenthood and all of these things that are making you question, like, do you do this? Do you not do this? So having some of that information ahead of time can help prep people for all of a sudden they're now going to be inundated with all of these things about saying, like, don't put the eye drops on your baby when they're born and don't give them the Hep vaccine, and all of those things. Preparing them ahead of time can be helpful.
I think for myself, when I'm working with patients in the hospital, we tend to ask questions of the patient kind of very open-endedly, especially towards the end of the encounter, like after we've gotten their history, we've done the physical, and we start talking about what's the plan of the day is going to be. And so rather than ask what, you know, rather than ask, do you have questions? The question is, what questions do you have? Or the other question I tend to ask patients, is there anything that I didn't ask you about that you want to talk about? Because it may be completely unrelated to what they're there for. And sometimes just kind of leaving that space so that they could actually interject, and maybe they don't know at what point to talk about it. So I think those open-ended questions help a lot to kind of tease out if there's something else going on or other information that they're hearing.
That makes a lot of sense. Yeah. I'm sure that all of us have also encountered there's this like anti-treatment misinformation, kind of like Liz, what the anti-vaccine, anti-science household you grew up in. But then I know we've all, at least either on social media or in clinic, been in a situation where we see some promotion of unproven treatments as another type of misinformation. And Jory, I'm wondering if there are any differences maybe in how between anti-treatment misinformation and promoting maybe not evidence-based treatment type misinformation, and how each of those spreads.
Such an interesting question. and I love being in this environment because it's a question I don't usually get posed. The answer comes back to what I say about all disinformation, all forms of falsehoods, is I recommend pulling yourself away just for a moment from the actual content, especially when you are a person who, as you say, is so used to relying on facts and focusing on the numbers and going to exactly what kind of information will disprove the information. If you first take a step back and look at the motivation behind any of it, and what it is trying to do and what it might be speaking to, it can lead you to a better starting point. So, for example, if there is a recommendation to engage in a certain treatment, my first thought is, well, a lot of people feel frustrated with the healthcare system. A lot of people feel frustrated that there's chemicals in their food. And we kind of are all agreeing that there are maybe chemicals in some foods and processed foods, and so there's a lot of real reasons why a person might say, oh, this alternative might be something I should consider. I have heard things that have been agreed upon as, previously good for me and now they're bad for me. Real things that have come from the medical community. And then I think about the fact that people are always wanting to improve themselves. They're always wanting to better themselves. Self-help and lifestyle coaching is one of the most popular, profitable topics on the internet. So people are always wanting to improve themselves. So I don't know that, I don't know that I have an answer in terms of anti versus proactive, but my starting point, if someone were to say something to me that I knew was not good for them, would probably be a starting point where I would be saying something. It is, we are like, I am also always trying to better myself, or it does often feel like we want to make sure we have the best ideas out there, and it can be overwhelming to know which ones are the best. Or I'd say something like, kind of acknowledging that even though this isn't new and it's been around forever, it's actually tried and trusted for a reason. Kind of just acknowledging their starting point and maybe trying to chip away at whatever thought that probably is true that might be behind them going toward this alternative path. Like, for example, frustrations with establishment anything, or frustrations with just political messages around healthcare and medicine that they've been hearing. There's usually a way to get at something that you can have really good resonance with, and then go to the place where you're engaging with them on the subject. I also think this, I'm curious what the other panelists think about this. I often tell people that first having your objective be to dislodge them from it, not so much debunk, can also help if it's sort of dislodge and then debunk, because if you kind of go in trying to debunk right away and don't even give them the chance to feel okay for even holding that belief, it can almost make them deepen. And then once you've dislodged, you might leave them open to hearing more facts and hearing more evidence that gets them to a place of having it debunked. Now, of course, in a medical situation, you might not have time for that two-step process, and you might have to do it a little bit faster. But I do find that you have a higher chance of success if the bar is not as high as going in to debunk in every conversation. And if your bar is, can I dislodge them? Can I actually just open their minds to some evidence or pose a question that gets them to not be so sure that this path is the right way? You might actually feel more productive and have a higher chance of success.
I agree with that, because I think a lot of times the hard part, especially for medical providers who you guys are busy and you have lots of patients you have to see, is that this process takes a lot of time and a lot of effort. And it really is building relationships with people so that they understand who you are and what you're saying and those types of things. So I do something very similar, is I never go in to a conversation when I'm having with a person and just say, no, you're wrong, and these are all the reasons why you're wrong, because that's not going to help. So I think I always try to emphasize compassion, because again, the feeling is valid, even if the information that they're basing that feeling on isn't, and then helping them from there. So that I really try to emphasize that compassion, because it is hard to navigate everything right now.
Yeah, I think that really resonates with, I like that saying dislodge and then debunk. In the hospital, I kind of have the luxury that some of people in clinic don't have, which is I have a patient there for a couple days and I can go back a couple times a day and just kind of chip away at it and kind of get them to warm up. But I think it's really important to just be able to sit there and kind of listen. A lot of times when there is a level of mistrust or trust has been broken, a lot of times that mistrust is there because they just have questions that haven't been answered or they haven't been given the space to ask those questions. And so making sure that you give them that space, I think goes a long way.
What I'm hearing, I think, as kind of a general theme in talking about all of these aspects of the spread of misinformation and kind of how we might interact with and counter it, is that at the end of the day, it really starts and maybe ends with trying to understand where the patient is coming from, maybe not even more so than where the misinformation is coming from and kind of all the details, but just kind of what is their personal starting baseline and motivations, or like motivations, whether or not they even realize them, but kind of their emotional, physical, mental state at the time. And I'm gonna open this up to all of you, but are there differences maybe, or what can we think of as we take that into account and then try to counsel patients on not spreading misinformation? And I think this, of course, assumes that, you know, that's kind of a step two if they have already kind of veered away from the misinformation. What is their role in spreading it? And is this even a thing that we should, you know, be trying to help stop?
Well, I'll say that I love to talk about how bad actors like you to do their work for them. So they all people who are pushing anything online rely on both product features from the platforms and those product features working in their favor, but both product features and bad actors rely on human engagement. And so they are wanting our engagement and they're wanting us to spread their message for them. And so I like talking about that because people generally don't like to be scammed and people don't like thinking that they're doing the bidding for someone else. You know, I really do feel people can be empowered when you remind them that the bad actor needs your trust with your family, your trust with your friends in your newsfeed. That's why they want you to engage. And it can just get people to feel like, you're right, I do have sort of a responsibility, or I have a desire to hold myself to a higher standard of the quality of checking I'm doing on the content that I'm putting forward. So there's like an empowerment message, I think, that does work because people don't like to be scammed and used. And people do usually feel a obligation to their friends and family. I also think that increasingly our news feeds and the spaces that we exist in online are not controlled by us, in the sense that things are showing up that we didn't ask to put there, like to be put there. We didn't proactively follow it. It's getting recommended to us, maybe because I like to give the example of, a parent searching for something because their child has an allergy, leading them to a really extreme political conspiracy space. And those pathways are sort of not our fault. It can happen to anybody. And I think when I talk to people about what they can be having conversations with in their community or at their dinner table, I say it's that sort of, hey, have you noticed how you sort of start in one place online and end up in a really different place? And just trying to open up the conversation with folks about how our online experiences might be taken to a place we don't realize, without really getting into any content specific, conversation.
I think for when we talk to individuals, I mean, again, going back to that kind of emotional link, I think understanding that when they see that misinformation, number one, is probably going to have a piece of clickbait. You're going to see it and you're going to want to click on it. But the instinct is so much to be like, oh my gosh, I'm going to hit the share button because so many more people have to know about this. They have to absolutely know about this. And so when I'm talking to patients about misinformation, it's, take a pause. Am I going to give someone the right information? If it were my sister, my daughter, do I want them, if they had to make a decision, is this the right information? And kind of showing them or talking about how to even just look to find out if something is a credible source. Who wrote it? Who wrote it? Who's publishing it? Is there a click say, or is there a link saying sponsored? Who is putting out this information and how to look at something critically?
Yeah, and one thing I try to remind people of is that like it's exactly what you were saying, Susie, is that like misinformation is more interesting a lot of the time. So then it gets shared more, and then the accurate information is not as interesting, it's not as sensational, and it doesn't get shared as much. So I try to encourage people when I'm talking to them is like if you found something valuable that was accurate, like the writing that I and those nerdy girls do, we need people who are willing to then share that to their friends and to their family to help amplify that good information, because it isn't as in a lot of cases as interesting or as sensational or as cool as that misinformation. So I try to emphasize, in addition to not interacting with the misinformation, amplifying those voices that are the trusted messengers.
Yeah, so I mean, it sounds like there's also an element of digital literacy that is, of course, going to be, everybody's going to be starting off at a different baseline. And yeah, so I want to make sure we also have some time to take questions from the audience. And I do see that we have one or two. So we'll go ahead and turn to that for now. And if there's still time at the end, we can also continue this more guided discussion. But Janet asks, or she said, Jory's statement that disinformation plays on real and true emotions makes so much sense. And she asks if there's a way to explore the emotions with the individual in a sensitive manner. And we'll open this up to all the panelists.
Well, I think Susie, talked about it and how she does it in the actual room with her patients. And I'm just, as someone who's not a doctor, but experiences doctors and my own, healthcare, I think there's a really interesting power dynamic in that setting, where, there's so much power that the doctor has. There's so much implied knowledge that the doctor has, that the person whose body is and healthcare is in question doesn't have. And I think that the best way to be sensitive on that is to, as Susie said, like bring in real stories or try to make it a more human conversation, and dismantle some of that dynamic. Not dismantle. I know I've talked to this audience before and they've said, doctors have said, but I do need to be credible. I don't want to, strip down everything and lose my credibility or not, come off as if I do have this disproportionate knowledge. And I think that the best way to do that is just not to wield it. Wield it in a way that tries to make that is any chance of making someone feel small or condescended to. So much of the conversations around what's false, especially in media reporting, comes off very condescending. If you take a look at how people write about disinformation and misinformation, especially how they did it over COVID, they really spoke in a derogatory way about people who were buying into falsehoods. And that really proliferated across the country and was sort of the tone online. And knowing that that has just been our recent history, I think a great way to be sensitive is just to treat them as if what they're saying is valid from the point of view of it's a very valid question or even a good question, or I can understand why that would make sense. I mean, I think if you just look at, in my own experience, there's been a lot of both research and then among my personal friend group conversation around misinformation and disinformation around hormonal birth control. It makes sense given my age cohort, given my friends having going through different stages of pregnancy and different stages of fertility, that we would be having this conversation. So the question in itself, or the thought or the belief in itself, is so valid. And if anyone made me feel like it was ridiculous for me to consider any of it, I would feel like, well, it's a little ridiculous that you think it's ridiculous, given given my age, given just like what life is like, in 2024. So that's where I would start with that, but very interested in the folks with the actual degrees in medicine and immunology.
So I think we ran into this, I think, especially probably the first 2 years of the pandemic where the response was, oh my gosh, it's so confusing. Like first you tell me to mask, then you tell me to not mask. And yeah, validating that frustration. I was like, you're right, I'm frustrated too. But the reality is we are learning as we go. And so validating it, but then giving some level of transparency that, hey, we're not perfect, we're learning, and we're going to learn with you. I think helps kind of create that rather than that doctor-patient relationship, which of course is always important, but making it from me and that person to we as a collective, like, hey, we're going to learn this together. We're both going to be looking at what's going on and figuring out what's going to be the best choice for you in this moment, as opposed to I'm right and you should do this because I say so.
Yeah, and I often think in the conversations that I have now, I'm not having them with patients, but I'm having them with people that I'm interacting with in all sorts of ways. And I often think about like, what do I wish that doctor had taken the time to talk to my mom about, right? Like if somebody had just been willing to like listen to her and acknowledge the fact that she was a new mom. And at the beginning, when you have a newborn, like it's insane. So it's understandable, right? That you have those conflicted emotions. And that's really where I try to have these conversations is like when they share what they're concerned about, or like I can know from an immunology perspective that that doesn't make sense, but I can understand from an emotional perspective why that emotion is there. So I try to just, again, I think Susie and I think Juari mentioned it too, is like come from a place of curiosity. Like ask them like, what is it that it is like, what are you worried about? Or asking those open-ended questions to try to get at those emotions. And then coming at that with compassion. And I think it's hard because we do expect a lot. And I want to recognize that we expect a lot of our medical community. There's a lot of demands on your time. And I think it's sometimes easier in a lot of times, right, to just shut the question down because you don't have the time. And that's also where I think it's important that there are other people having these conversations with them as well, to have in general more people doing this kind of work, which is why I try to get more scientists doing this kind of work too, because we shouldn't, it can't only be the medical community that fixes this too, because there's already so much on your shoulders. So we really need to have conversations about getting all of these individuals active in communicating with the public and building a culture where there is more scientific and data literacy in general.
So actually, building off of that idea of that there are all these, it's not just physicians and it's also not just scientists too, it's policymakers and really like so many actors in the community. And of course, we at Doctors for America love advocating. And so I'm wondering if there are any ways that we can advocate for stronger policies that would directly or maybe indirectly help kind of treat this misinformation, disinformation issue that we see so frequently.
I feel like I've been speaking first a lot, but I two things. First, most industries have safety standards that the industry legally is held accountable to. The tech industry does not have that. We are in the process of putting forward legislation in Europe. They've successfully done it. In the UK, they've successfully done it, although it went through a big battle before it crossed the line. In the US, we've not yet done it. I think pushing for legislation where the starting point is the tech industry should have to hold itself to safety standards, submit risk assessments, produce a report on how they performed in those risk assessments, like every other industry, good starting point. That hasn't been our starting point. And one of the reasons it hasn't been our starting point is because there are industries that have a vested interest in keeping the conversation on speech. So we naturally experience this problem through narratives and content. When we are bringing that as our starting point to the policy conversation, it gets trapped in a free speech debate, which is actually, in order to protect free speech, it would be really good for tech companies to have safety standards that they were holding themselves to, because right now online we have a very curated speech environment. Having a conversation about free speech is actually a distraction from conversations about what safety standards should the tech companies be held to. And so, when there are policy conversations around this, if the starting place is coming from defining harm, defining which narratives are wrong and right, we're already in a bad place, because it is moving us away from a much easier step that is a lot less nuanced about how they can actually just be transparent with users and with the public about safety on their platform. And that can be defined in a much easier way, and there are models for it. I do think that trap is something that keeps people from engaging in legislation or in conversations about this. And so the more we can do to move people away from that trap, the better.
I think Liz brought up a good point about making sure that we're pulling in other people, not just physicians, to help do the work of addressing misinformation and disinformation. One of the projects that we're doing with a couple of different institutions is a project, it's NIH funded, but it's a project called Dime la Verdad, Tell Me the Truth. And what it is actually we're teaching community health workers. So we're partnering with trusted messengers already within the community, have been there for years, and teaching them over the course of about 3 weeks how to identify misinformation, how to talk to people, kind of having these same conversations that we're having, but also in terms of addressing misinformation, amplifying and creating their own content, their own infographics to talk about some of the myths that they are currently hearing about in the community. So I think partnering as much as we can with trusted messengers, I think pulls in so many more people to that messaging that we want them to hear. We want them to hear the credible messaging.
I'm a big proponent of making like scientific findings more understandable to the public, because I feel like this is one of the big things that science is so inaccessible. The papers are behind paywalls, the language is complicated. Like there's so many barriers to the lay audience being able to access this information. So it's very easy for anyone to take a paper and misrepresent it, because the general public don't have the skills or the ability or the resources to advocate for that. So I am a big advocate for open science in terms of making sure that papers are open and freely accessible to all individuals. And then the other big thing I really want is I want all journals to require lay summaries that are written so that the public can understand what was done, what is the actual meaning of these findings, so that it isn't so easy. It will still happen, of course, but then at least there is this fallback that you're not just trusting this other person who's telling you what they want that paper to say. So making it a little bit easier for that information to be accessible. And then again, with the work that I do too, is I'm big into trying to increase science education at our earliest ages, so that we can really start building in some of this critical thinking and understanding, so that by the time they're older, hopefully it is more embedded.
Yeah, it sounds like with, the 15 to 20 minutes that we often have with patients in clinic, there's what we can do then, and there's all this other stuff that we can advocate for on the outside, which has me really optimistic, at least, just hearing about all the different avenues that we as physicians and scientists can explore to try to help make some progress in this. So before we close, I do want to give you all a chance to, if there's any other last thoughts you want to share with the attendees, you have some time right now, so please feel free. Okay, and if not, I see that we don't have any more questions from the audience. So I'm going to hand this over to Elle for some final thoughts.
I do have one comment though. I think I kind of already touched on it already, but I do want to thank you guys for even being here because my best friend is a medical doctor, and while I am not in the field, I see the daily struggle that she goes through. So I appreciate the fact that people who are in the thick of it already taking care of patients are also thinking about these other problems. And that's why I want to emphasize that it shouldn't just be you in the trenches doing this work, that we need it to be all of us together fighting this problem. But thank you for taking the time to even listen.
I just want to emphasize that. Thank you all so much for taking the time to come tonight. Most of all, to our incredible panel of speakers. It's such a rich conversation. Now I have the difficult job of trying to sum up so much depth in just a couple of words with a couple of takeaways for tonight. Just thinking about where we're coming from, where patients are coming from with their misinformation, some key themes that came out tonight. We're recognizing the emotions that underlie misinformation, acknowledging the emotions, and the exhaustion, which is a target for misinformation spread, when recognizing that it's not just about the information that patients are sharing, but the baseline emotions attached to that. I loved Susie's comment about coming from a place of curiosity when addressing misinformation with patients. Many of us got into medicine and science because we're naturally curious people, so bringing that into those conversations and letting that part of our vulnerability be there in the space with patients. And recognizing that we may not always have the answers, but that we have the same goals, which is to keep our patients safe and to help them better themselves. Liz shared with us the inoculation theory of misinformation, which as a theorist, I absolutely love. So preparing people ahead of time for the type of misinformation they may encounter is a proactive way to think about, who your patients are and what kind of information they may be exposed to. Making sure that we ask open-ended questions, not just, do you have questions, but what questions do you have? What things do you want to talk about that we haven't talked about yet? And then Jory brought up the great approach of dislodging, then debunking, emphasizing compassion, recognizing underlying feelings are valid, and then empowering our patients, both in recognizing how misinformation is spread, but encouraging them to pause before spreading information and to take the time to spread the less attractive scientific information, which brings us to the note that today is World Polio Awareness Day. And I know that because it was on Liz's Instagram. So thank you for sharing that with us. And then acknowledging our humanness as we learn together. And then some advocacy steps that we can take is addressing the safety standards that tech companies currently are not held to, but that need to be established to hold them accountable, that exist in other industries and exist abroad for tech companies. And approaching policy changes from this perspective rather than from approaches that get entrenched within the free speech debate. And then I think one of the other big things that we can advocate for as both individuals, institutions, and together with our peers is the accessibility of science, as Liz was saying. Open science, lay interpretation, making sure that our patients actually have access to the information to inform themselves, but aren't just relying on us to interpret it for them, can go a long way in building those bridges of trust. Is there anything that I missed in that whirlwind summary?
Great summary.
Thank you. So with all of that in mind, I do just want to point you guys to a list of resources that Liz made in advance that is now in the chat. And I would encourage you to reference, it's a fantastic list of curated resources to help you continue the conversation, continue your own exploration and understanding of misinformation. Link to the recorded presentation will be available soon. Slides will be sent out, and for DFA members, you can follow the link to earn CME credits for having attended this situation. And with that in mind, if there are no more questions, I would just like to thank everyone again for being here. A huge, huge thank you to Susie, Jory, and Liz for taking the time tonight to share their expertise with us, for all that you do to teach us, to share your time and your expertise with your colleagues, and to really advocate for change in your local communities and nationally. So thank you.